Hi, my name is Chandra. I'm 51 years old and I'm a nurse. I've been nursing for several years. Last year, 22nd of June 2018, I had a pacemaker inserted for my sixth sinus syndrome, which was diagnosed very suddenly. I have made another video yesterday and I explained all about my medical history. And if you could still not watch that video, I think it will be better to watch the first one, uh, as this is my second video. So this morning I went into the hospital and my appointment was 7:15 and I was taken to a waiting area straight away. From there I was taken to the cath lab, where nurses came and introduced themselves and inserted the cannula into my arm to give the anesthetic and antibiotics. The consultants and anesthetists and registrar, they all came and introduced themselves and explained to me the procedure. They were very, very polite, kind, and professional. I'll thank you for all the staff from bottom of my heart. So after I signed the consent form, they took me into the theatre where all the staff had a very quick brief in few seconds about my case while I was awake. And the anesthetist told me that I'll feel a little bit ooziness. That's all I remember. And I woke up in the recovery area just before 12 o'clock. And I saw two nurses around me, so they were happy with everything. And they did my blood pressures. They said they were all stable and offered me a cup of tea and sandwich, which I thoroughly enjoyed because I was very hungry and felt very, very dry. About another hour later, I was discharged from the recovery area and sent me down to the waiting area again. And I felt okay, although I was exhausted. It's because since last night, 9 p.m., I haven't had anything to eat. I've been ill by mouth and only had a drop of water this morning with my medications. So that was one reason. And I was worried when I went into the hospital this morning about my procedure. But after I've been talking to the consultants and anesthetists and other staff, I felt much, much better. So now I feel tired and my incision site is beginning to hurt a little bit, painful. I got home a little while ago. So I'm going to have plenty of water to drink and a nice cup of tea. And I'm going to have a bit of rest. So in my experience from last time, I know that I was okay when I got home, but the following day I was in agony. I couldn't get out from the bed even. It's because I was in quite a lot of pain. So hopefully, fingers crossed, it won't happen this time. So tomorrow morning I'll feel okay. I'm going to take some extra painkillers tonight and get into bed early and have a rest. I will record another video tomorrow or day after, and I'll let you know how I'm getting on, how I feel after my new hypoallergenic pacemaker. So the consultant told me that when he was explaining everything, he had about 800 patients which he operate, and from those 800 he had only one patient who became allergic to his or her pacemaker, and I was the second one. So it is a very rare allergic reactions. So I think it is better for patients after you are having your pacemaker, if you have a bit of swelling in your arms or leg, in your body, if you get in bit of itchiness or rash, you feel burning and hot, and you feel sweaty and very uncomfortable, are you in quite a lot of pain, just go to your GP and let them know, because you could be allergic to metals which you don't know even. I knew myself since I was a little girl. I'm allergic to most of the metals because I couldn't wear even very little small like a stud earrings even. My yellow ball get red, and sometimes if I keep it few days, I get it's very sore and oozing like a wound, exudates. So I knew I was allergic to it, and I shouldn't have had that pacemaker, uh, non-allergic one, uh, in the first place. So maybe, I should have had a temporary pacemaker until they found a hypoallergenic pacemaker for me. But what is done now. So I have got a new pacemaker today. It is being swapped today for non-allergic or hypoallergenic pacemaker. So hopefully this will be okay, fingers crossed. And the pacemaker was inserted in the same place, same incision. They cut into the same incision, so when the dressing comes off, it won't be that bad. And as we discussed before in my clinic, they didn't implant the new pacemaker deep in my muscles, because the consultant explained to me that in a few more years to come, 10 or 15 years to come, when they come to change my pacemaker, when the battery is low, so they might accidentally cut into the wires, or they may kink, so then that will give me problem again. So therefore they have inserted the new pacemaker into the same pocket. So the problem was I'm having an allergic reaction, not the place it was in. So therefore they went for the safest option for me for now and for many years to come. So that is all for now. So I hope I'll be okay tomorrow, and I will record another video tomorrow, day after. Then I'll let you know how I'm getting on. Until then, thank you for watching, and goodbye.